What's going on, guys? Welcome back to W.D.Y.D. CSP. What do you do as a central sterile processor? Alright, guys, I have my face shield on, and we're about to process a TEE probe on the Astra TEE high-level disinfector processor. Alright, so let me go ahead and grab me a fresh pair of gloves. Alright, so that TEE probe was cleaned and deconned. And I will talk about that process later on in another video. So when you process a TE probe on the high-level disinfectant, minimum PPE is required is the gloves and the face shield, right? So we're going to go ahead and grab our TE probe here. All right. And we're going to follow the on-screen instructions. I'm sorry I can't show you it because, again, no one's taping for me. I am doing this myself. So the first step is to scan the scope, scan the TE probe. And then once you scan it, it tells you to insert it. Now you can process up to 2 TE probes on this unit at a time. All right, put the cord over the rest cord so no stress goes on. And then I am plugging up the end there to the receptor there. All right, the next thing it's asking for is for the patient ID. All right, and that's been scanned there. And I have no other scope. So I'm going to go ahead and close the door and then ask for operator ID, which is myself. The next thing it's going to ask for is for the test strip. So minimum effective concentration or minimum recommended concentration, whichever one you want to call it. All right, you want to go ahead and grab a strip out of there. Be careful not to touch the part that dips into the high-level disinfectant and close the lid immediately. All right, so I am waiting for the chamber to fill up with high-level disinfectant. Okay, you don't want to look directly in there. That's the reason for the face shield, just in case any splashing. But everything is pretty contained because the lid is closed there. All right, you slide the lid back. Go ahead and dip in there for a second. And then you're going to close that lid again. And that's what it's going to look like. I'm going to tap it on that little towel I put in there. And then go ahead and wait my time. All right, so this is a 90-second read. Now, while I'm doing that read, we also have to leak test, electronically leak test your TE probe. So there's the probe. It has to be in the solution at least an inch. And I'm sorry I'm not showing you the leak tester right now, but it is mounted on the wall there, or it's just sitting in a rack on the wall. I'm going to show you that right now. All right, so you see that the countdown is on there. I'm at 56 seconds for my test strip there. And then I'm about to leak test this scope there. So you put down the probe down in one of the chambers there. I already had the settings in there, and there you go with the leak testing. All right, it does several tests there. It tests the conductivity of the solution, the voltage in the battery. All right, and there you go right there, and then the probe. So that passed right there. Now you leave the probe in there. Some people take the probe out. Might as well leave it in there, let it go through the whole disinfectant process, because at the end there's a rinse cycle and you can rinse that disinfectant off the probe. I find that very helpful. One of the things too is if you're operating this machine with the test strip, you cannot walk away and allow that test strip to just go ahead and read and not acknowledge the pass or fail. So we're going to compare it to the back of the bottle. No blotching on that test strip. It is a pass. So we're going to go ahead and pass it. We already passed our leak test. And then there you go. Disinfection takes 11 minutes on this unit. The whole process takes about 15 minutes. At this point, you've already did everything you had to do. You can go ahead and walk away. You don't have to take the probe out immediately after the cycle is completed. All right, so at this point, I am going to go ahead and take off my PPEs because I'm done with this process. All right, so now we are back, guys. So the probe has passed disinfection, and now it's time to bag it up or place it in its container or get it out of the machine so that I can transport it to the unit. So first things first, this is a disinfected probe. The only part that was high level disinfected is the part that goes into the patient. So fresh pair of gloves here. And if you've heard my videos before, this is where I have a problem with these processes, and we'll talk about that some other time. So I'm going to need a couple things here. I'm going to need a tip protector for the probe, and I'm going to need a hang tag. We have a 7-day hang life for our, or storage life for our high-level disinfected probes, and flexible scopes. So we're going to go ahead and put the seal on the end cap there, on the power cap. Gonna coil our cord there, not too tightly. Okay, I'm gonna go ahead and grasp the control handle here. And before I do that, you want to grab a sterile towel and you want to dry off the probe here. All right, there you go. I'm gonna go ahead and walk over to the container I'm going to place it in that's lined with a sterile towel as well. Put down the control body and the cord. Go ahead and finish wiping off the tip of the insertion part of the TE probe and put the tip protector on there. All right, and again, I apologize that I'm doing this at a distance. I have no one recording me. I never ask anyone to record my videos because they got work to do just like I got work to do, right? So go ahead and sorting this out here. At this point here, I can go ahead and take off my PPEs after I wipe my leak tester off, right? I almost forgot about that bad boy. All right, so I'm gonna go ahead and place that in its little area there. Okay, I'll go ahead and take off my gloves here, and I'm going to show you the information that I have to jot down on this card and show you how we store it for transport, how we prepare for transport. Right, so it's in a basket lined with a sterile towel. Okay, the power cord isn't coiled up too tightly. Tip protector on the insertion tube, and it is wrapped nice and loose. So now the information that goes on this hang tag is the serial number of the actual scope, my initials, and the month and the date, 7 days of the day it was processed, right? So today is the 8th, okay, we're in March, and counting today, 7 days after gives me the 14th, right? My initials, and then I gotta go ahead and get my tag that I placed into my tracking system so I can get this serial number rather than reaching back in the basket and touching that TE probe. All right, so there's my serial number there. It is that BX number there, that BX, that B2X D06. So I'm gonna go ahead and place that on my hang tag there. All right, and then we put a dust cover over it, place my label on the bag, and then the only thing that's left to put on there is a clean, not sterile sticker. All right, guys, as always, stay true to yourselves, keep it 100, continue educating yourself. Peace.